Hello and welcome. My name is Emily and I'm a public health inspector with Southwestern Public Health. We know you are busy and we appreciate you taking the time today to watch this video and review how to complete the laboratory requisition forms required for submitting respiratory and stool samples to the Public Health Ontario labs for outbreak testing. We hope you find our time together today valuable and that you will share this video with your colleagues in your workplace. This educational video will cover when and how to complete a Public Health Ontario COVID-19 and respiratory virus test requisition and a Public Health Ontario general test requisition. Now let's get started. During suspected and confirmed outbreaks, Southwestern Public Health will provide your facility with an outbreak number to track the specimens collected. The Outbreak Control Measures document includes a section on specimen collection, instructing your facility on what specimens should be collected and which requisition form or forms should be completed. It is important to collect samples for those who have new and unexplained respiratory or enteric symptoms. It is also important to ensure requisition forms are completed accurately to receive timely test results. Let's have a look at the Public Health Ontario COVID-19 and respiratory virus test requisition. This requisition is used when submitting a respiratory sample, such as a nasopharyngeal swab. It is used for COVID-19 only testing for individuals with enteric symptoms at the beginning of an outbreak to rule out COVID-19 as the cause of the symptoms. If this is a sample related to an outbreak, Southwestern Public Health will provide a pre-filled requisition with the submitter section populated with the information for our Medical Officer of Health. If applicable, your facility should complete the section titled Other Authorized Healthcare Provider with the healthcare provider information for your long-term care or retirement home, so the test results will be sent to your facility. If you are submitting the specimen for a resident in a group home or other congregate living home, enter the resident's healthcare provider in this section. Complete the patient information in Section 2 with all available information. If the Ontario Health Card information is unavailable, write unavailable in this field. An outbreak number must be entered for suspect and confirmed outbreaks. An old outbreak number should not be used. If an outbreak investigation number is not available, leave that section blank. In Section 5, Test or Tests Requested, select COVID-19 virus and respiratory viruses for individuals with respiratory symptoms. Select COVID-19 only for individuals with non-respiratory symptoms or for testing of symptomatic staff. In Section 6, Specimen Type, select the type of sample collected and include the collection date. In Section 7, Patient Setting/Type, select the patient setting. For institutions, please include the facility name. In Section 9, Clinical Information, select the patient symptoms and include the symptom onset date. If symptom information is not entered, then the test requested may not be completed. It is essential to label the test container with the patient's full name, date of collection, and one other unique identifier, such as the patient's date of birth or health card number. Double-check the requisition and specimen label to make sure they are complete, correct, and that they match. If the specimen is not labeled properly, then testing will be canceled. Finally, place the specimen in the main compartment of the biohazard bag. Place the fully completed test requisition in the outer side pocket of the biohazard bag so that it is not exposed to the specimen. Now, I am going to review some key points for the completion of the Public Health Ontario General Test Requisition. This form is very similar to the requisition form for respiratory testing. However, it is used when submitting a stool sample for residents with enteric symptoms, such as vomiting and diarrhea. Similar to the respiratory requisition form, enter the name and license number for the clinician ordering the test. For outbreak samples, Southwestern Public Health will provide a requisition pre-filled with the Medical Officer of Health as the ordering healthcare provider. Complete the Copy To section with the information for the facility where the resident lives to ensure you receive the results. Complete all fields of patient information and enter an outbreak number if there is a suspect or confirmed enteric outbreak. Select feces as the type of sample collected, as well as the collection date and symptoms. In the Testing Indications/Criteria section, select Diagnosis. Enter enteric, bacterial culture, and gastroenteritis, stool viruses in the test. You have now reached the end of our educational video on completing test requisitions for Public Health Ontario labs. We hope you found this information helpful and easily applicable to your daily work in a long-term care home, retirement home, or other congregate living setting. For more information on managing an outbreak, you can watch our video on outbreak control measures. Thank you.